Good morning. I am Dr. Jacque Gray, the director of the National Indigenous Elder Justice Initiative at the University of North Dakota. It's also known as NIJI, so you'll often hear people referring to NIJI. Let me pull up my slides and share my screen. And we'll get started. Back to the beginning. So today the focus is going to be on what is elder abuse, and in looking at elder abuse in Indian country specifically. So we anticipate there will be an increase in the number of elders in Indian country, and this is age 65 and older, to triple between 2014 and 2060. So that is a major increase in just 45 years, 46 years. So 90% of elder abuse is committed by a family member. And this is in general. And those elders who have been abused are twice as likely to die than those who have not been mistreated, according to the National Council on Aging. Now, nationally, when we talk about financial abuse and financial exploitation of older Americans, $37 billion a year is the cost of it is to elders across the country. And when we look at these numbers, they're really thought to be underreported because they love the person that's exploited them, and so they don't want to turn them in, or they feel that the abuser may harm them in some way, so they're hesitant to report. So when we talk about elder abuse, it generally refers to any of the following types of mistreatment that are committed by someone with whom the elderly person has a special relationship: a spouse, a sibling, a child, a friend, or a caregiver. The types are physical, sexual, emotional and psychological, financial exploitation, neglect, self-neglect, and abandonment. And again, these are the 7 types that you find as far as legalities are concerned, for the most part. But there's one other type that we talk about that's spiritual abuse, where colonization or any abuse impacting the values and identity of a person. According to Duran and Duran, that's soul wounding. But Gray and Labori have reported that as spiritual abuse. And we started working on that definition of spiritual abuse because elders were asking us, why haven't you included spiritual abuse? That's something we think needs to be taken care of. So we worked and developed this definition in our work with the elders of what was spiritual abuse. Now, physical abuse is defined as the use of physical force that may result in bodily injury, physical pain, or impairment, according to the National Center on Elder Abuse. Some types of physical abuse can include acts of violence, such as striking, hitting, pushing, shaking, slapping, kicking, pinching, or burning. Additionally, some inappropriate use of medication to medically restrain someone, physical restraints, force feeding, and any type of physical punishment can also be physical abuse. Now, some examples that we've been given is an elder is hit by an adult child. That's pretty clear cut. But then an elderly man with dementia hitting his wife can be considered elder abuse. Now, granted, there are extenuating circumstances with that have to be addressed, but those are things that need to be taken into consideration. A daughter hits the elder, and it's coming from the stress of meeting the elder's needs and their health needs. Someone taking drugs or using alcohol, and that leads to yelling and hitting other family members. Again, the physical aspects of that. Emotional or psychological abuse is defined as the infliction of anguish, pain, or distress through verbal and nonverbal acts. This may include verbal assaults, insults, threats, intimidation, humiliation, harassment, or disrespect. Some examples include things like elder speak, when someone talks to an elder as if they're an infant, or that they're a very young child, giving the elder the silent treatment, refusing to speak to them, forcing isolation, locking them in a room, or making sure that anybody that comes to visit them can't see them, and then making threats. Some of the examples of psychological abuse include grown children moving in with the elder and drinking, fighting, taking their money, and chasing away caregivers. Now, you may see some exploitation and other things in that example, but a lot of that also impacts the elder emotionally and psychologically. Confining an elder in one room with no ability to interact with other family or friends. Verbal abuse by young family members, disrespecting that elder. Children threatening the parents or grandparents that they'll be put in a nursing home if they don't allow that child or grandchild to move in with them. Not listening when the elders speak, and treating them as if they don't matter anymore. That was one that was really important to the elders. Now, sexual abuse is the non-consensual sexual contact of any kind, or sexual contact with a person who is not consented or is incapable of consent is considered sexual abuse. Some examples include rape, unwanted touching, molestation, sodomy, coerced nudity, taking or distributing sexually explicit photographs or videos. Now, some examples that are given are grandma was raped by a male that was high on meth and broke into her house. She was ashamed. She wouldn't report or tell anyone. But after someone sat with her and talked with her for a couple of hours, she finally agreed to go to the hospital for an exam to make sure she was okay. An elderly male sexually assaulted by a caregiver. He wouldn't talk and he was ashamed. An elderly woman raped and killed, leaving an elderly person exposed. Those are all examples, but you hear very little about this because of the shame involved in sexual abuse. Now, the one we're going to be talking a lot more about through this series is financial or material exploitation. So financial abuse is defined as the illegal or improper use of an elderly person's funds, property, or assets. Some examples include cashing their checks without authorization or permission, forging a signature on important papers, misusing or stealing money or possessions, coercing or deceiving an older person into signing documents, contracts, a will, other types of documents that they really don't want to sign. And then improper use of conservatorship, guardianship, or power of attorney. Some examples, including a granddaughter that wiped out grandma's bank account, misusing an elderly person's monthly check and not paying for food or bills for the one that it's intended. Grandson taking grandpa's personal items. A niece took Auntie check. Grandchildren pressured the grandparent for money, or a son borrowed money and didn't pay it back. The granddaughter and boyfriend moved in and then were supported by their elderly grandmother. Neglect is defined as the refusal or failure to fulfill any part of a person's obligations or duties due to an elderly or duties to the elderly or disabled adult. That neglect may include a failure of a person who has fiduciary responsibilities to provide care for a vulnerable adult. That, for example, paying for the necessary home care services, or failure on the part of an in-home service provider to provide necessary care. Some examples of neglect include failing to provide necessities such as food, water, clothing, shelter, personal hygiene, medication, comfort, personal safety, and other essentials that are included in an implied or agreed upon responsibility to a vulnerable adult. So whether it's a family member that has agreed to take on those responsibilities or a caregiver that's hired to take on those responsibilities, that makes that their duty to take care of those adults. Some examples include the elderly uncle that's confined to the home and the family wouldn't provide any support for him. Failing to obtain proper medical treatment for grandma, or the family locks grandpa in a room at home. Not visiting or taking the grandparents to gatherings. All of those are aspects of, in addition to the others that I mentioned as far as neglect. Another type of abuse is self-neglect. Now, self-neglect is characterized as the behavior of the elderly person themselves that threatens his or her own health or safety. So this is an elderly person that is on their own and things that they are doing that neglects their own well-being. Signs and symptoms of self-neglect include, but are not limited to, dehydration, malnutrition, untreated or improperly attended medical conditions, and poor personal hygiene. Some examples of self-neglect include things like the uncle's electricity has been turned off because he didn't get the bill paid and all his food is spoiled in the refrigerator. Grandma doesn't take her medications because they cost too much. Auntie's unable to take care of herself but won't tell anyone and get help. Grandpa continues to drink until he passes out or falls. He won't let anybody help him or get treatment. Abandonment is another type of neglect. It's defined as the desertion of an elderly person by an individual who's assumed responsibility for providing care for the elder, or by a person with physical custody of the elder. Some of the signs and symptoms of abandonment include, but are not limited to, the desertion of an elder at a hospital, a nursing facility, or other institution. The desertion of an elder at a shopping center or other public location. An elderly person's own report of being abandoned. Some examples include the family going away and leaving grandma without food or drinking water. Grandpa's not left with any resources for personal hygiene. Leaving grandma at a shopping center and not coming back for hours to find her. Leaving grandpa who has dementia at the IHS clinic alone to wait for his appointment. And then spiritual abuse. Spiritual abuse is defined as the harmful interference with spiritual growth, including the corruption of another person's value system. Some examples include preventing grandma from attending spiritual activities or ceremonies, theft of grandpa's ceremonial items to sell or use without permission, comments or activities which are damaging to the elder person's spirit, or sexual abuse as a spiritual activity. So what causes elder abuse? Well, some elder abuse is due to caregiver stress, that they have the responsibility for extreme care of an elder 24/7. And there are no breaks for any respite to kind of recover. And so that buildup of stress can result in elder abuse. Sometimes that's used as an excuse, but that's one thing to take a look at, is what stressors are there on the caregiver. Our violent society, a lot of times in families where there was abuse, maybe of the kids growing up, or domestic violence in the home, then those caregivers end up being violent toward that elder when they become dependent on them. A sense of entitlement, especially around financial exploitation, that they deserve whatever it is they can get from that elder. Sometimes it's greed. They just want what someone else has. There's ageism, that, you know, people just don't respect those that are older and elders in our communities. It's a power and control issue, and this goes back to a lot of the interpersonal violence types of things, is having that power and control over someone else and determining when they can eat and when they can sleep, and very rigid and restricting type of environment. Actually, all of those are related to the causes for elder abuse. So why does elder abuse happen? Well, to begin with, elders are very trusting in nature. They take people at their word. They're perceived to be easy to fool or to con. And so people take advantage and manipulate elderly. And as we talk about more of those things around scams and all in some of the other presentations, you'll see where some of those things come into play. The elderly have a steady source of income, and so that makes them a good target to try to access those resources. And then isolation. They can't get around like they did before, and so it makes them more vulnerable because not that many people are stopping by and checking up on them to make sure they're doing okay. And there are other things as to why elder abuse happens. But when it does, there are some definite health effects other than the physical injuries that might occur by physical abuse. When someone is abused, as I said earlier, they're twice as likely to die than those that are not abused in whatever way it is. There's poor physical outcomes from any medical treatment. They just don't respond as well. They have more pain if they're being abused. It raises overall pain levels, and it makes any condition that they currently have, whether it's diabetes, heart disease, or something else, it makes it worse. Related to the physical abuse, there may be welts, wounds, or injuries that are very slow to heal. And they're much more susceptible to infection. And I think we've seen with the pandemic and the high numbers of deaths in nursing homes that all of the things that contribute from the isolation and the stresses and the increased susceptibility to infection, we've had a much higher death rate in those nursing homes. So some of the financial effects of elder abuse, you usually don't get any restitution, or it takes a long time, so it's too late to really help the elder. They don't have time to rebuild their assets because they've reached that point that they're now drawing down on their assets, not building them. They lose a lot of choices, and they lose a lot of independence when they've been exploited financially and have fewer resources. And then you don't see that intergenerational transfer of any wealth or anything that the elder might have going to those that they want it to go to. And they more quickly spin down to where all they have access to is Medicaid. So what are some of the high-risk situations or red flags that we talk about? People with inadequately treated mental health or substance abuse problems are more likely to be abusive. So a caregiver trying to deal with an elder who has a substance abuse issue, or a caregiver who has a substance abuse issue, there can be abuse in either direction with that. People who feel stressed, burdened, and resentful are more likely to be abusive. So if someone's taking care of an older auntie or grandma and they don't want to be doing it, they are forced into doing it somehow and resent that, they're more apt to be abusive. People providing for an older adult who's physically combative or verbally abusive. I think we see this a lot in Alzheimer's and dementia cases, especially where the person is disoriented and doesn't know where they are, doesn't know who people are. They're very fearful and they tend to act out physically. So when you're asking about elder abuse, don't ask if they've been abused. You'll be told, no, they haven't been abused. But if you start the conversation asking about, has anybody disrespected you? And how might they have disrespected you? Then you're more apt to get the stories that get you the information to determine whether or not someone has been abused or neglected. And around sexual abuse, you might ask, has anybody bothered you? That tends to be a less inflammatory and easier discussion to have than if you ask about sexual abuse, you'll be shut down immediately. It's best practice as far as screening for abuse that everybody should be screened at their intake. And it's important, whether it's senior centers or other programs, to normalize talking about difficult topics. You know, if it's an ombudsman visiting the nursing home, if it's one of the APS workers just dropping by the senior center to visit with the seniors, you know, normalize talking about different types of abuse and neglect and how those types of things happen, so that it's not something that's hidden. And then screening helps to potentially catch abuse in its early stage and prevent it from escalating. So when you're screening the elder, you might ask, has anybody hurt you? Are you afraid of anybody? Is anyone taking or using your money without your permission? Those are all things that can be helpful. So around financial abuse, it's important to talk to the elders about planning ahead. You know, what kinds of things do they want to happen? They need to stay connected with other people so that if something happens, someone knows to get hold of help or to check on them. Being cautious, not just handing money over to somebody that asks for it, but making sure that they're checking things out and it's legitimate what they're being asked to do. And then to report their suspicion so that someone can check into it and find out before someone else is taken advantage of. Another thing is the Elder Protection Team, or in your case, the Elder Protection Task Force, addresses the issues of elder abuse and is dependent upon the resources of each specific tribe. So it may differ. Many tribes don't have adult protective services. So it's making use of what resources are available in your community to address the issues. Some of those responsibilities may include educating the community and conducting prevention activities, building collaboration and trust among the professionals, the elderly, and the families, that you're there to help, not to cause problems and throw people in jail. Provide empathetic listening. Be there to understand, not just to be an enforcer. Implementing the effective method for responding to elder abuse while maintaining confidentiality. And it's really important that confidentiality be maintained. If people think the business is going to be talked about across the reservation, you're going to have a much more difficult time addressing any problems. Reporting suspected abuse and interviewing when necessary. And most of all, restoring the respect of the elderly. So when we talk about members of that elder protection team or elder protection task force, it always includes the elder. And then due to the complexity of elder abuse and the makeup of the team, depending on the resources available, it's going to vary. But it should include caregivers, healthcare, family, community, senior services, and legal aspects, so that you're getting all of those resources. You know, sometimes housing is in there. Sometimes other groups are in there as a part of the program. So physical changes in old age reduce the ability to conduct activities of daily living and maintain independence. As people get older, as far as their health, they have poorer vision, poorer hearing, declining motor skills, depression. I'm noticing a lot of those with the poorer vision and the declining motor skills and things like that for myself. And so knowing that those things are more difficult. Cognitively, they have difficulty processing information, problem solving, reasoning, flexibility in thinking, and a declining memory. And then social isolation. The poorer health makes it harder for them to get out and around, and they tire more quickly. Retirement. They're not as engaged in the community if they aren't connecting with their friends. If they have a loss of a spouse or loss of friends, it makes them more and more isolated as they get older. I was just talking with my aunt who turned 91 last weekend. And, you know, she was talking about the person that she had shared a home with for 43 years had passed. And all of the neighbors around her house that had been there in all the years that she had lived there were gone. And she just didn't have any connection anywhere anymore. And she was trying to think through, you know, where should she think about living? It was hard for her to maintain her house. All of those things make it more difficult and make them more isolated socially. And then the lack of technology skills. They aren't as able to connect. I know I sent her a message on Facebook and she picked up the phone and called me because she didn't know how to respond to the message on Facebook. You know, dealing with those, they got to deal with the technology that they know or have someone to help them utilize the newer technologies. Okay. So there are 3 levels of prevention when we start talking about elder abuse prevention. So among those many ways to help prevent abuse and neglect, we talk about primary prevention, secondary prevention, and tertiary prevention. Now, primary prevention involves education of everyone about what elder abuse is and how to prevent it. It's getting the information out there, how to contact you, all of those great things. The secondary prevention involves work done with elders who are at risk. And it can include a range of preventative things such as fall prevention or safety scans of the elder's home to set up ways of preventing exploitation. Any of those things, working with them so that they know about scams and things like that in order to avoid them. Tertiary prevention is how to prevent elder abuse that has happened to someone before from happening again. So that's, you know, we want to try to take care of things at the primary and the secondary level so that it doesn't reach the tertiary level. Okay. So identifying problems and concerns. The National Center on Elder Abuse estimated for every reported case of elder abuse, 14 cases will go unreported. So we're talking more than 1 in 10 or 14 times as much elder abuse occurring as gets reported. Very little is known about how widespread elder abuse is in Indian country. And there's no infrastructure or coordinated systems that are currently in place for prevention, protection, and support of the elder. Very few tribes have an adult protective services, and only about 100 tribes at this point in time have an elder abuse code that can be enforced. Understanding what constitutes elder abuse is difficult, and many elders may only consider victimization as physical abuse, and that increases the risks of other types of abuse. So if they don't fit their imaginary visual of what an elder abuse victim is, maybe someone with a broken arm and a black eye and things like that. And if it doesn't fit that, then they aren't being abused. So helping them to understand that there are other types of abuse that may not have physical signs that appear. So NIJI's intended purpose is the general consensus that people may not know what constitutes elder abuse and neglect. And since they don't know, we need to educate them about what it is. We are trying to produce information on how to define and recognize elder abuse in Indian country, and to educate everyone on elder abuse and neglect and learn ways how to prevent it. So creation of culturally relevant materials, providing viewers with training tools and information about elder abuse and neglect, specifically materials geared for formal and informal care providers, law enforcement, and the elders themselves. In doing that, on June 15th, 2016, we launched our first Native American elder abuse educational online interactive module that is available on our website at www.nieji.org. It's designed for professional disciplines that are working closely with Native American elders. It has ways, we have several different modules, including one on the elder, or what is elder abuse, one for caregivers, social services, one on financial exploitation for vendors and anyone that does any type of financial exchange with elders, legal, which includes law enforcement, attorneys, and judges, policy that includes developing an elder abuse code, an elder protection team, and all of the policies that have led up to where the laws are today. One for healthcare workers, and we have one on pharmaceuticals that I'm hoping to have out by the 1st of the month. This one addresses not only the impact of opioids, but all kinds of drug-related interactions and other issues with the elderly that need to be checked on. So the modules contain valuable information to gain a cultural understanding and best practices in those various disciplines addressing elder abuse and neglect in Indian country. Each training module includes aims and learning objectives for professionals working closely with Native American elders. It has ways for professionals to identify potential signs and risk factors for elder abuse and neglect, and how to report suspected abuse to the proper authorities. And also included are culturally appropriate practices, such as the use of language when working with elders. All of those to help professionals address these concerns and be respectful in the manner in which they interact with Native traditional beliefs and practices. Now, the online modules on elder abuse and neglect, as I said, are on the NIJI website. And we recommend that people watch the elder feather first. Each of these feathers light up to take people directly to the module. And it's on the training tab on our website. And we have 6 completed trainings right now, and we're adding, again, a 7th one that is focused more on pharmacy. At the completion of the training, a person can put their name in and the date is put in, and you can print out a certificate of completion. And we're working on some things to see if we can get some type of overall certificate for completing certain numbers of the modules and things like that. These are some of the references that were in the materials that I addressed. And these are some of the NIJI partners, the Elder Resource Centers, the National Indian Council on Aging, our elder abuse resources, including the National Center on Elder Abuse, the Center of Excellence on Elder Abuse and Neglect, the Elder for Financial Protection Network, and the National Long-Term Care Ombudsman Resource Center. So at this point, I will say, Wado, thank you, and open things for questions. Do we have any at this time? I'll stop sharing my screen so we can get to questions. Any questions? No questions at all? Or any in the chat box? None in the chat box. Okay, well, if we have no questions, I guess we will end the session there. And I look forward to talking with you again next time on some other materials that we have to present. Thank you and have a great day.
Thank you, Jackie.